So, lovely. Assalamu alaikum, everyone, and welcome to today's webinar. I'm just going to go around and get each of the speakers to introduce themselves, inshallah. So we'll start with Myira.
Hello, assalamu alaikum everybody. I'm Myira, an accredited counsellor, supervisor and tutor, and the founder of the MCAPN, the Muslim Counsellor and Psychotherapist Network.
Thank you. Sahar.
Assalamu alaikum everybody, good evening. I'm Sahar Beg. I am an accredited counsellor and I'm a supervisor and trainer, and I am the founder and CEO of Mindworks UK.
Lovely, thank you. Sheikh Saeed.
Assalamu alaikum everyone. My name is Saeed. I'm an integrative counsellor and a clinical supervisor. Also do a lot of work for Approachable parenting on parenting courses and training, as well as marriage for those who are married and those who are coming to marriage, premarital workshops.
Okay, thank you. Dr. Imrana.
Assalamu alaikum everyone. So I'm Imrana. I'm representing BIMA today, so I'm the interim lead for mental health at BIMA, and my day job is I'm a GP in East London. I've got a few other roles which I think may be relevant for today. So I also work as a clinical lead for mental health for North East London ICB. I apologise, there's lots of acronyms. I will explain what they are if anyone wants. As Integrated Care Commissioning Board, I'm also a trainer for a research project, De-Stress project, which trains GPs on managing patients with poverty-related mental distress. And I'm also working with NICE, which is the National Institute of Clinical Excellence, looking specific as a clinical advisor, looking specifically at digitally enabled therapies for anxiety and depression. So really looking forward to the hour, and thank you to our delegates for also joining on this Wednesday evening.
Thank you so much, Imrana. And last but not least, Isma.
Assalamu alaikum everyone. I'm Isma. I'm a pharmacist with a special interest in mental health. I am representing Inspirited Myira today as their outreach and support lead. So we're a mental health charity that sort of raises awareness, provides counselling, CBT and many other services. And my role is to focus on developing materials for workshops, facilitating talks and support groups, and working with imams really.
Amazing, thank you. So as you can see, we've got an excellent panel of very accomplished guests, speakers, mashallah. So we're going to start off just looking at what anxiety is and what isn't anxiety. So for this one, I'm handing over to Sahar.
So anxiety, what is it? It's, it is an anxiety disorder that is part of mental health conditions that we have. There's lots of different anxiety conditions, and some of those are, that we can feel. So the feeling part is you might respond to a situation, and it might be quite fear. You might have quite a lot of fear. You might have a lot of dread. It might involve some trauma. You might experience some physical signs of anxiety, such as your pounding heart, like mine is right now. So it's like pounding heart, and I'm not sweating, but you can sweat as well. Yes. So anxiety, it hits us all. So me as a practitioner too. So sitting here with everybody. So it's normal to have anxiety. It's healthy. Some of it's healthy, and I know Imran is going to talk a bit more about that. So you might feel anxiety or nervousness when you're doing a presentation. You might have a work issue that you've got to go through. You might have an interview, for instance. That's quite a common feeling of anxiety, is when there's butterflies in your tummy and your heart is pounding, you're sweating, and you might be rubbing your hands, or you might be feeling quite nervous and walking around a lot. Just a few examples. There's lots of different things that people will experience for what happens to them. But anxiety also, it helps us to also think about when we're in a situation of danger, for instance. So our the focus becomes internal, and it's like the adrenaline is going, and we're kind of thinking what's going on, and the body will look after itself. It will start looking after itself. So we want to be able to then stay safe, and the body will create that for you. I know there's a lot of health anxiety that can come with it, and I know that we're going to carry on talking about that as we go along. It can go beyond regular nervousness. So it could be a slight fear you might have from time to time, and anxiety might be like your heart, as I said, the heart rate might go up, you're breathing, you're sweating, you might be trembling, and that happens quite a lot for lots of people. I'm not sure why they're feeling like that and what's going on. So they might not know that they're having an anxiety attack at that point, So they might be thinking that, oh, there's something else going on. Like, it could feel like you're dying. You're having your heart is pounding so much, you're having a heart attack. So it is going to be about understanding the differences, which Imrana will be talking about. You might be feeling quite, overwhelmed with things, and it might cause you to be quite tired or fatigued, trouble concentrating and thinking about, your everyday, what you're doing, and it might be that worry. So there might be general worries that you have every day that could lead into anxiety. So nothing is small, everything can become big. So the smaller it is, it might become big, but it's okay. There's lots of help for that. It can interfere in your day-to-day, your ability to function. And this point, I'm now going to hand over to Imrana, because she is going to talk a little bit more about the health side of things.
Jazakallah khair, Sahar. So yeah, Jamilla, thank you. That's a great place to start. What is anxiety? So it's a really important question. I think sometimes there's a lot of assumptions about it. So I think it's really important to make it clear. And, and it may be surprising for our delegates to hear that even within professional conversations, we have this conversation. So I think what Sahar has described actually so beautifully is those symptoms of anxiety and how they can affect different people in different ways. And just to go back to basics, anxiety is a word in the Oxford Dictionary. It's anxious. Anxious is an adjective, so it's a describing word, and anxiety is a noun. So I think this a very kind of clear distinction between anxious, anxiety, and from a clinical point of view, an anxiety disorder. So I think there's been a lot, again, within practitioners, and clinicians, there's been a lot of hesitation about a lot of, I think, the normalizing of the word anxiety, and people are using a lot more. But I think from my point of view, I think as long as we're very clear that anxiety is this feeling and this experience, and then we shouldn't not validate people's experiences because that's what they're feeling and that's how they're describing it, but how that's different to an anxiety disorder. So, anxiety disorder is an umbrella term for a variety of different disorders. I think Sahar touched on some of them: health anxiety, even phobias, like, if you've got kind of a severe fear of spiders, different types of phobias. There's post-traumatic stress disorder, and there's various panic disorder, I think Sahar talked about as well. So the disorders are very defined, because they're defined by certain symptoms within certain standardized criteria. So from a clinical point of view, anxiety is that umbrella anxiety disorder is that umbrella term for diagnosable clinical conditions, and anxiety itself is an experience that patients feel.
Amazing, thank you for that distinction, Imrana. We've seen, or it's becoming increasingly common, I guess, for people to almost self-diagnose with anxiety. And I think that's coming as people get more awareness around anxiety and around mental health more generally. So what are the pros and cons of self-diagnosis?
So I think in regards to the pros and the cons around it, I think when you're not sure that something you're not sure what's going on in your body, and it's always good to then speak to your GP. If you're feeling something like your heart might be pounding, and we think, oh, am I having a heart attack? Or, oh, this is just anxiety I'm feeling. But actually, we don't know. So it's really important to go to your GP, get checked out, because if we're feeling, oh, it's a heart attack, it could be a heart attack. We don't know. It's just a heart is pounding. It could just be anxiety. So it's really important when you notice your body, the internal side of things, that actually something doesn't feel right. So it's important to everybody here today. If you're feeling something, or you have clients or family or friends, and they're telling you, actually, I don't feel too good, something's going on, get it checked out. That's the immediate thing that we need to do. Self-diagnosis, we could self-diagnose in many things. We always say, don't look up Mr. Google. you know. So I think many people do that, and I would say not to, I mean, unless it's the NHS website, they have actually good things on there. But I wouldn't go onto Mr. Google and start self-diagnosing yourself, because it would be detrimental, and you're going to get yourself into more of a panic, and that anxiety will just kind of, you know, move to a scale quite high. Imrana?
Yeah, thanks, Sarah. I think I see it in a slightly different lens. So I think thinking about, again, looking at the distinction between anxiety and anxiety disorder. So I think if more people are kind of noticing, as you say, noticing how they're feeling, having that self-awareness, and then, you know, perhaps having a look on the internet, speaking to people and thinking, yes, I think I've got anxiety. I think, you know, there's lots of pros of that, you know, for people doing that, you know, self-empowerment. When we go on to talk about treatments for anxiety, a lot of it is within the realm of self-help, you know, a well-being strategy. So I think we shouldn't fear the people being more aware of themselves and their feelings. But I think as you've described as well, is people again, self-diagnosing to the extent where they're getting all the information on, you know, online resources. And as you described, some obviously lots of really useful online resources, but a lot of misinformation out there as well, particularly with, you know, what people are looking at, you know, 1 minute TikTok videos and then getting a diagnosis at the end of it. So I think that the harm part of it is if people get to the stage where it's impacting their function in their life, but they're not seeking help professionally. So that's the bit I think, you know, I do agree with. So at that point, definitely seek help. But I wouldn't discourage people from kind of, you know, building that awareness about themselves, discussing with friends, with trusted loved ones, and also having a look to see what resources are available.
Amazing, thank you both. So we've mentioned a few of the physical symptoms of anxiety. Are there any more that either of you would like to add?
I think we've covered some of the symptoms. And I think it's that feeling of nervousness, restlessness, feeling tense. You know, when we're having sense of danger or panic, or, you know, doom almost, you know, and there's the common ones. These are the common ones at the moment. And we've talked about the body, the sweat and everything. Imran, is there anything you'd like to say?
Sorry, my unmute button was eluding me. Yeah, no, I agree with what you've said. So the central kind of tenet of anxiety is that excessive worry. And it's excessive and persistent worry. So you've described that very well, and there's obviously physical symptoms and, you know, psychological symptoms. I think when worry becomes persistent, then I think you get some of the other symptoms, which sometimes can be quite prominent. For example, fatigue, you know, tiredness, brain fog, difficulty concentrating, difficulties with sleep. And as a GP, actually, often these are some of the symptoms that people present with, rather than having that awareness that this is coming from, you know, a place of anxiety.
Thank you both. I think that's really helpful, because I think sometimes when we think of mental health conditions or illnesses, we don't always think of the physical symptoms that might go alongside them. So that's really helpful. Thank you. So moving on, there's still stigma that exists around anxiety and around mental illness, especially within Muslim communities. Isma, what are the stigmas that exist about anxiety within Muslim communities?
I think it very much depends on what form of anxiety is as well, because anxiety does come in different forms. So it could be something like social anxiety, could be OCD, could be a generalized anxiety disorder. So each of these have their own stigma. But I think the most common one, I would say, within Muslim communities is people thinking that having anxiety is a sign that you don't have enough faith in Allah subhanahu wa ta'ala. So thinking that's part of you having weak iman and not having enough faith in his plan for you. And basically just doubting his ability to protect you from harm. Which is quite ironic, because when you speak to a lot of people who have anxiety, a lot of Muslims who have anxiety, they use that as a source of comfort. They use the qadr of Allah subhanahu wa ta'ala as their comfort. But the stigma attached is that people do assume that you don't have enough faith in Allah, you don't have enough faith in what his plan is for you. I think some other general sort of stigmas are, or kind of misconceptions even, are just thinking that it's just you being a little bit awkward or you being a bit shy. And I don't think with something like social anxiety disorder, which is an actual medical diagnosis, people just tend to brush that off as just being, like I said, a little bit awkward. And even as both Sahar and Imrana mentioned, just the importance of self-diagnosis. There's people out there that, you know, say comments like, "Oh, I'm so OCD," when really they're just a little bit more organized than the average member of the public. So it's just recognizing the differentiation between a real medical diagnosis of OCD and being a little bit more organized. I think another thing that I've come across quite commonly with anxiety in particular is people not being able to differentiate between anxiety and stress. So again, it's being aware that stress is a very normal reaction. It's very normal for everyone to experience stress at some point in their life. But anxiety is a sustained mental health disorder that can be triggered by stress, that can be triggered by traumatic life events, by chronic stressful environments and more. And anxiety doesn't just fade into the distance once the threat is pacified. Instead, it can stay around for the long haul and cause significant impairment socially, professionally, and other important areas of functioning. So it's just really people just having an attitude of not really taking it importantly as a medical illness. And I think something to remember is that anxiety is not one size fits all. So anxiety presents differently in different people. So you might know two people who have anxiety, but they might present very differently from each other. They might have completely different symptoms. So that's something that's really important to bear in mind as well when we're looking into our communities. It's not the case that everyone with anxiety will come along with exactly the same symptoms. They'll differ between them. And the impact of stigma is such that those who actually have anxiety, the perception is that they feel that if they do tell somebody, if they do tell their family and friends, they'll have a negative attitude towards their condition, and that will kind of impact their decision to even seek support, because they feel as if those people don't have any real understanding in what's going on in someone else's mind, in the mind of someone who has an anxiety disorder. So those are the sort of summary of the kind of stigmas or the misconceptions surrounding anxiety in general.
Thank you so much, Isma. I especially like what you said regarding it's not a one size fits all when it comes to anxiety, and people can present differently. There are some questions being asked in the chat, so we're going to save those for the end for the Q&A session. But Imrana, what happens when someone has the courage and comes to the GP with anxiety? I think a lot of times people are nervous to seek help because they're not sure what's going to happen, what the GP is going to say. So would you be able to shed a little bit of light on that?
Thank you, Jamilla. Again, an excellent question. I think, and you've kind of put the nail on the head that people don't come straight away to the GP. And I think, I mean, as we've discussed before, in some ways, rightly so, because some of this can be a normal reaction. But if it does become persistent and it's affecting kind of your social functioning, then I think absolutely come and see your GP. So the first thing I would say is actually, and again, I had a patient this week who it took him a long time to come to a GP, many years. And so the first thing I did to him is I congratulated him. I said, you know, well done. This is a brave step for people to come and seek help. So so that's the first thing. And I think just a few, I guess, general principles about what to expect. So, you know, you however your GP surgery works, either online or you call them or you turn up at the reception and you ask to see a GP regarding, you know, if you say anxiety, you may not be seen by a GP. You may be offered an appointment with a nurse practitioner, or we have mental health practitioners, we have health and wellbeing coaches, physician's associate, first thing I'd say is don't worry. The person that you'll be seeing is qualified to make that assessment and assess your symptoms. So even if it's not a GP, and again, we work as a team within our practice, in our network. So we do, we have that liaison and that multidisciplinary part to general practice. But again, if you're quite keen to see your GP, then that should be possible. But it just may mean that you may have to wait longer. I'm sure I know that's another can of worms. People are struggling to get appointments. There are shortages of GPs, but we do have a multidisciplinary team, and use the resources that we have. So I would say, I guess the other couple of things about when you come to see your GP is, firstly, we've discussed who you might see. The other thing is what happens in the consultation. So just for you to be aware that some of those, the questions that the GP asks you will be quite intuitive, exploring more about your anxiety, but there may be questions where you feel that this isn't directly related to your anxiety, but just again to reassure you that kind of we use a biopsychosocial model. So we have to understand your kind of lived experience, what's happening in your life, what's happened in the past, to make that formulation. So if you're asked about your job and your relationships and who you live with, it's all in context to try and understand you better. Again, you may not have to do any of this because you may have a GP who's known you for 20 years and they know all of this, but in this day and age, you may or may not have that. The other thing, again, just not to be alarmed if you come in talking about anxiety. So we know anxiety can exist in isolation, but more commonly it doesn't. So it's a common mental health illness, and it's often overlapped with depression and also other mental health disorders. So you may be asked various different questions, and often you'll be asked about kind of what we class as risk. So that's about kind of suicidality. You may be taken aback by that question, but it's just, again, be reassured these are standard questions that we do need to ask to kind of assess that level of risk. And I won't kind of go into all the details of the treatment options. Hopefully that will come up in the discussion later. But just to be reassured that, again, I've talked about this biopsychosocial model. So when you come to your GP, hopefully your GP won't just listen to you say that I've got anxiety and send you away with a prescription. Expect it to be kind of personalized, to be holistic, and also that the treatment options are discussed with you, but you make a shared plan together.
Thank you so much, Imrana. I think that's really helpful, especially if someone with anxiety, probably another anxiety, is going to the GP to talk about said anxiety. So that really shed some light on what will happen if you go and see your GP. So we've covered what will happen if you go to the GP, and now we're going to cover what will happen when you go to therapy or you seek out counselling for anxiety. So I'm going to go to Myira. So what will happen if someone came to you for mainstream counselling with anxiety? What would happen?
Yeah. Well, it's interesting because the first thing I was thinking about was how complementary it is to what Imrana just said about going to the GP, that there is a bit of a parallel process going on. The first thing I really want to state is that coming to see a counsellor or a therapist about anxiety is so common that kind of within the profession, it's kind of seen as the work that's almost seen as like our bread and butter. It's something that we work with almost on a daily basis. It's so common in working with anxiety alongside with depression. So I think the first thing to really reiterate and really state is, for somebody coming to counselling for help with their anxiety, you will certainly not be the first person to ever come to that therapist with anxiety, and you definitely won't be the last. It is one of the most common, as I said, alongside depression. Anxiety and depression are the two most common things that people come to counselling for. So please don't feel that you will be the only one, certainly not the first, certainly not the last. So I really want to state that first of all. At that point, then, it's about recognising that to come and access therapy or counselling, there are so many different what we call modalities, types of counselling that you can access. And I think it's really important that as a client potentially coming to access counselling, that you don't just go along with the first counsellor that you kind of stumble across and their way of working. I think it's really important to, first of all, either do some research or homework or speak to that counsellor in your assessment of the type of counselling that they are going to offer you. And the reason why it's really important to recognise and identify the type or the modality of counselling that they're going to offer you is because the process, the approach that they might use may or may not suit you. And what I mean by that is that there are some very common, more well-known mainstream therapeutic modalities such as CBT. I'm sure many of you in the audience tonight will have heard of that. Or maybe person-centered or humanistic counselling. And thirdly, there are the more psychodynamic, psychoanalytic therapies. So very broadly, they're the three very common modalities of counselling. So it's really important that in speaking to a counsellor, in identifying what modalities they work with, it's then for you to be able to figure out, will that suit you? And it's important to know whether that will suit you or not, because, as I said, some of these modalities are either going to offer what is called a directive process, or what's known as an emergent process. And what I mean by that is a directive process will be one in which the therapist might be working with a very particular directive way of working with you. There might be particular questions, there might be particular worksheets or homework sheets that you will work through. There is already a set process, a directed process that the counsellor will facilitate you through, guide you through. And CBT is the most obvious and most common one of those modalities, versus what we might call an emergent process, in which and that's leaning more towards the humanistic, person-centered or psychodynamic, psychoanalytic types of modalities. That is much more traditionally known as talking therapies, in which you will sit in your sessions with that counsellor, and it is through talking through your experiences that the process emerges, that by talking about your experiences and certainly your feelings of your anxiety, we can start to get to a point then of understanding what is underneath it, what is sitting at the root or the core of that anxiety. Now, I think it's really important that for anyone then looking to get support for therapeutic support for their anxiety, that they will then know which of those two processes appeals to them more. Very often, what we'll find is certainly clients that come to me, I can work short term and long term. I work very integratively. So what's their CBT in there? It's primarily psychodynamic and psychoanalytic in its leaning, as well as humanistic. And so what I notice is that maybe a lot of clients come to me because they've experienced the short-term CBT approach, and that might have worked for them short-term whilst they were in that 6-week or 12-week program. But they're looking to do a bit more deeper work once they've kind of sat with and understood how they can manage their anxiety in the here and now. And once they feel better, perhaps with the CBT, and it's manageable in their everyday, they then want to start doing some deeper work into the root causes of their anxiety. So again, I mention all of that. So again, people can start to make informed choices about the type of counselling that they want to access for their anxiety. Again, as Imrana mentioned, it's really important that your therapy then is like going to the GP. The treatment, the work, the support you're going to access then, it is going to be personalised for you, and it is going to be holistic. And in a similar vein then, when you go for an assessment with a counsellor or a therapist, equally, that might feel a little bit intrusive, because we're going to be asking you all of that kind of wraparound and background information about your context, and for us as the counsellor to be able to start making an assessment of how to work with and support your anxiety. So as I quickly mentioned, there are some those are some different mainstream approaches to counselling and to supporting you in your anxiety. So I hope that's just a really quick overview of how mainstream therapeutic modalities can support you. And it's really important that you find one that suits you and how you want to access treatment and support for your anxiety.
Thank you so much, Myra. That was really helpful. I think in my mind still, when I think about counselling, I think of Freud talking to me while I'm laying on a sofa. And I know that's very outdated. Right, now, I hope you'll get that image out of your mind. Now we're going to discuss Islamic counselling. And Sheikh Saeed, what happens when someone comes to you for Islamic counselling? Does it differ from mainstream counselling?
Jazakallah khair, Jamilla. Bismillah ar-Rahman ar-Rahim. So Islamic counseling is, as the term says, is rooted in Islam, meaning that is rooted in the Quran and Sunnah. So what we do as Muslim trained counselors, and I just re-emphasize the point that Sister Myra said, that it's really important when you go to therapists, you go to counselors, you do your homework, you make sure that they have the relevant training, they have relevant experiences, because that's really important. Also, in terms of Muslim Islamic counseling and psychotherapy, there's a lot of training, a lot of supervision. So we ensure that firstly, people are trained in how Islam conceptualizes the human being. So Allah subhanahu wa ta'ala is the one who created us. And he created us as people who have needs and have these kind of trials and tribulations that we go through in life. So firstly is about understanding the human person from an Islamic perspective, and according to the fitrah, the primordial nature that Allah subhanahu wa ta'ala created human beings upon. So that's the first thing. Secondly, we look at the person in a holistic manner. So we look at the different dimensions of human development and human needs from an Islamic perspective. So when we look at the human being we look at the physical dimension, we look at the social dimension, the psychological dimension, the cognitive, and the spiritual dimension. And it's very important to have the spiritual dimension at the core of any treatment, in terms of the connection with Allah subhanahu wa ta'ala, how that person relate to themselves and relate to the rest of the world around them. So when we see the Islamic model of counseling, as we said, is rooted in Quran and Sunnah. So we know that Allah subhanahu wa ta'ala said, الَّذِي خَلَقَ الْمَوْتَ وَالْحَيَاةِ. Indeed, he is the one who created life and death to test you, to see which ones are the best amongst you in actions and deeds. So we know trials and tribulations and dealing with that is part of life. And it happens. It's just how we deal with it, how we use the resources that Allah subhanahu wa ta'ala has given us through the Quran and through the Sunnah of the Prophet sallallahu alaihi wasallam, and we utilize that. So the person will be working, firstly, we understand the condition, and we, by talking to the client and building the relationship, building that connection. Secondly, we look at how the person think about their condition and the thought process that they have, and how that relates to Islam in terms of the Quran and Sunnah, and how they use that to help them to overcome that difficulty. Number three, we also look at the behavior and how the behavior, because Islam, the Prophet said, when Allah sends a disease, he sent a cure for it. So it's important that we know that this is part of life. We have to be aware of the condition. We have to, how we think about it, and then we utilize the behavioral changes that we can do in our life. From an Islamic perspective, we look at that person's life, how they live in their life, how they dealing with things, and how they, what are the stress points in their life, and how we can help to release some of that stress. Just to give an example, so one of the things that we use in Islamic counseling is the concept of tawakkul, which is a reliance on Allah subhanahu wa ta'ala, and having trust of Allah, building the trust with Allah subhanahu wa ta'ala, that Allah subhanahu wa ta'ala will not forsake us, will not abandon us. And there are many examples we can give from Quran and Sunnah, from the life of the Prophet sallallahu alaihi wasallam, and how we use tawakkul, how we rely on Allah subhanahu wa ta'ala. At the same time, we do what is in our capacity to help ourselves. And then we look at the stories also from the Quran and Sunnah, and how those people who suffered from anxiety, from trial, tribulations, trauma, how did they cope? What was the pathway they followed? And what was the treatment plan they had in their life, through using, for example, salah as to help the person ground themselves, using dua and making dua part of our life to ask Allah subhanahu wa ta'ala. So we can see an example. The Prophet one time, he was in the masjid, And one of the companions, Abu Umama, may Allah be pleased with him, came to the masjid and he looked distressed. And the Prophet ﷺ asked him, said, yeah, Abu Umama, what's going on for you? I can see you are stressed. He said, I've been overwhelmed by worries and overwhelmed by debt. So the Prophet ﷺ did not say to him, you know, have a strong iman, or he did not say to him, you know, go and do this or that. He dealt with him in a compassionate manner. And he said to him, shall I teach you words that if you say them, they will help you, inshallah. So he taught him the dua, which we say today, Allahumma inni a'udhu bika min al-hammi wal-hazan. Allah, seek refuge in you from anxiety and from sorrow. Wa min al-ajzi wal-kasal, and from being overwhelmed by lack of capacity or weakness or vulnerability that disabled me to do what is good for me. Wa min al-jubni wal-bukhl, and from cowardice or lack of courage, and from miserliness. Woman ghalabat ad-daini wa qahr ar-rijal, to be overwhelmed by debt or to be oppressed by men. So we can see from this hadith that the Prophet ﷺ also gave us the narrative that you have to firstly seek refuge on Allah subhanahu wa ta'ala from anxiety and from sadness. But at the same time, we ask Allah to protect us also from lack of capacity or weakness, meaning that we use what is in our capacity, what the resources we have. So the Islamic model also work on the resources that we have, you know, in terms of our faith, in terms of the blessings that we have in our lives that Allah has granted us. Also, we work on things like patience, we work on gratitude, we work on facing our fears. And we know that nothing will affect us without the decree of Allah subhanahu wa ta'ala. So we also put our trust in Allah subhanahu wa ta'ala. And then number 4, just finally, is we also work on the principles of our deep-rooted beliefs. You know, what is our belief system, and how can our belief system, our aqidah, can help us to deal with those difficulties, to deal with those trials and tribulations by affirming things in our mind, by connecting with Allah subhanahu wa ta'ala through times of difficulty and challenge. And Allah subhanahu wa ta'ala says in the Quran, فَفِرُّوا إِلَى اللَّهِ, run towards Allah. You know, when we feel, when we have fear, normally in everyday life, we run away from the fear. But Allah subhanahu wa ta'ala is saying, when you have that fear, run to Allah subhanahu wa ta'ala and call upon him, and he, inshallah, the doors of help and the doors of resolving these issues, inshallah, will open, inshallah, with the will of Allah subhanahu wa ta'ala, by relying on Allah subhanahu wa ta'ala, at the same time, doing what is in our capacity to help ourselves.
Thank you so much, Sheikh Saeed. That was beautiful. Myira, you had something to add?
Yeah, what I'm reminded of, as Brother Saeed mentions, and really allows us to recognize that with a spiritual, with a faith base, with Islamic counseling, that there is a direct link between how we can understand our feelings and our experiences of mental health, and the direct link then to understanding it from our faith. And it's kind of grounded in, it's embedded within our faith, kind of the answers are there. And I was thinking, in a way, kind of how that is, bear with me here, kind of go with me here, kind of reflected in other modalities. What I mean by that is that every therapeutic modality, and this then includes Islamic counseling, has its own specific, unique, own understanding of our sense of self, of our psyche, of our soul, of our mental, emotional, spiritual, physical, psychological well-being, and the makeup of that. And I suppose I kind of wanted to really iterate that. So thinking about what might happen when you go for therapy and the different types of therapies that are out there, there is a direct link between a therapeutic modality and what they do in the room in terms of its treatment and its approach to a client, a direct link between what they do in the room therapeutically, and a direct link then to what they understand theoretically about anxiety itself. So I want to make it really clear then that, so the experience of the therapy that you might get, and how that therapy is being delivered, whether that's, as I mentioned earlier, a directive or an emergent process, it will be because that's rooted then in its theoretical understanding of its roots of anxiety. So based on a modality's understanding of why anxiety might be being experienced, or where anxiety, what's the cause of anxiety, or where it's rooted, the treatment then, the therapy then will be modelled, its process will be based upon its understanding of its roots and causes of anxiety. So I just want to kind of reiterate, there's a direct link then between the two.
Thank you, Myra. So now we've spoken about what will happen if you go to therapy, what will happen if you go to the GP, and we're going to now talk about what are the different but complementary treatments for anxiety. So I'm sure our speakers will cover that, you know, you don't just have to go to the GP, you can also go for counselling, you can also go for Islamic counselling as well. I'm going to come to Sheikh Saeed first. So within the Islamic approach for a treatment to anxiety, is the solution just to pray more, or what is it?
No, is obviously, as Sister Myra said, I think we have to understand the condition according to the principles and the parameters of Quran and Sunnah. So how the human beings are created and what caused them to be stressed, what caused the anxiety. You know, is it physical? Is it environmental? Is it historical trauma? Is it so based on the analysis of the condition and the roots of the condition, then you develop a treatment plan. So for someone, you know, who has fear maybe and that anxiety, we can use, so one of the things that, you know, from Islamic perspective is facing our fears and dealing with them and being able to develop that step by step. So when we look at the Islamic model of treatment, is a very incremental, it's done gradually. So you build it up, you build the skills, the knowledge, the practice, the behavioral change into place, and then you do it with the collaboration. So the most important thing is to build that slowly and gradually with the client. And then you can use different things. So for example, you know, connecting with Allah subhanahu wa ta'ala can be through many ways of connection. So, you know, first we can connect, maybe some people find comfort and ease, and when they read the Quran and they read Quranic stories, and how, you know, for example, we can see the Prophet ﷺ, when he experienced, you know, sadness, how Allah subhanahu wa ta'ala revealed, you know, for example, Surah Al-Duha, chapter 93. And in that chapter is a very small chapter, but it has a whole list of, you know, things that Prophet ﷺ was taught by Allah subhanahu wa ta'ala to help him, you know, navigate that sadness that he was feeling. So we can develop those kind of, you know, treatment plan from the Quran. Also, we look at the Sunnah of the Prophet ﷺ. So dua is one part of it, prayer could be one part of it, exercise could be one part of it, facing our fears could be one part of it, and having, you know, challenging our fears. Tawakkul and trust of Allah subhanahu wa ta'ala could be part of it. Also, sometimes a lot of clients find the names of Allah subhanahu wa ta'ala, the 99 names, and how they, you know, finding meaning in the names of Allah subhanahu wa ta'ala and relating it to their own condition. So, you know, when we feel fear and we turn towards Allah subhanahu wa ta'ala and we understand, you know, the names of Allah subhanahu wa ta'ala, we call upon Allah subhanahu wa ta'ala with his names. There are so many things that we can do, but it just depends on the client and their condition. And also each client is, you know, you can't fit everyone into the same category, because anxiety, as illustrated earlier, affects people in different ways. Also, I think from an Islamic perspective, sometimes anxiety is environmentally based. So we have to deal with the root cause. So if someone has got fear about, you know, they don't feel safe at home, then we talk to them and say, you know, how can you make your home safe? You know, by taking the necessary steps to do that, because then that fear will be alleviated when the root cause goes. So it is a holistic model that looks at the whole dimension, as we said earlier, from the physical to the cognitive to the spiritual dimension, as well as the social and the emotional dimensions.
Thank you, Sheikh Saeed. And would Islam also encourage individuals struggling with anxiety to also get medical help as well?
Absolutely, because the Prophet said in hadith, he said, when Allah sends a disease or an illness, he will send the cue for it. You know, alimha man alim wa jahilha min jahil. Those who know it will know it, and those who ignore it, you know, they will ignore it, but the cure is there. You know, Allah subhanahu wa ta'ala did not send illnesses or diseases, you know, without sending the cure for them. So it's very important that we seek help. You know, you know, for example, part of our tradition, you know, the Islamic model of you know, the hospitals were built in 7th century and 8th century, you know, in places like Baghdad and Egypt. And so they use a holistic model. For example, they used to use water therapy by listening to sounds that are you know, give that relaxation, or Quran recitation. Or they would use physical exercise in the courtyard, and they will build the courtyard as part of the hospital. They will use the masjid also for the spiritual view and the spiritual dimension as part of the hospital. We went to hospitals in Turkey, for example, and you had the masjid in the courtyard as well. The courtyard, the hospital, the treatment places, the sleeping quarters, you know, where people would be resting, the places where they would do their social activities. So Islam look at the human being as a whole. And when we look at the treatment, also we look at the treatment plan as a whole, and we look at the whole human being.
Thank you so much. I'm going to come to Isma now for what are the treatments when it comes to a mainstream counselling approach?
So in terms of, I'm not going to touch too much on the obviously the Islamic side of things, so Sheikh Saeed has already covered that. But did you mean as in that complementary treatments with in addition to mainstream counselling?
Yeah, so when someone comes with anxiety to a mainstream counsellor, what kind of treatments would be involved there?
Yeah, so there's a range of sort of complementary treatments that go alongside the counselling as well. So there's 3 sort of main steps that we sort of cover when it comes to anxiety. I think one of the most popular, I guess, exercises when it comes to handling anxiety is the 5 senses exercise. So that's an exercise that makes you focus on the 5 senses. So 5 things you can see, 4 things you can hear, 3 things you can feel, 2 things you can smell, and 1 thing you can taste. And that's just to make sure that you can try to regain your thoughts and focus in the present and not get lost in the whirlwind. And this also helps those people who have anxiety to practice being aware of their environment. On top of that, there's a very app that I like particularly, and it's called a worry tree. So that allows you to just put all your worries in that app, and you can set a particular worry time. So rather than worrying all day, you set a particular time. So say for maybe 15 minutes or 20 minutes in a day, you can spend that time worrying, but the rest of your day is without worry. And that's sort of to make sure that you can try to get on as best as you can with your day-to-day life. So not letting your worries overtake your entire day. Another sort of popular concept is keeping a worry diary as well, but actually compartmentalizing them. So you compartmentalize them into 2 different types of worries. So the first type of worry would be like a hypothetical worry. So that's something that you wouldn't be able to control, and you have to remind yourself of that this is completely out of your hands. The second type of worry would be a practical worry, and that's where these are worries that you can actually control yourself. And then you'd be encouraged to create an action plan based on those worries. With regards to sort of specific anxiety disorders, so with social anxiety, for example, it's a little bit similar to what Sheikh Saeed said. So it's about facing your fears. So with something like that, we'd recommend an exposure exercise where, say, if you really struggle to leave the home and at the most you can only go once a month, you set yourself weekly goals or challenges to expose yourself and face your fears. So where, for example, you might set a goal of maybe going to the shops once a week with somebody else with you and using the cashier option instead of self-checkout. And then as the weeks go on, you increase the frequency. So again, you're exposing yourself to your fears, and then kind of boosting your confidence and realizing that it's not actually as bad as you thought it would be. For something like OCD, obviously, again, anxiety is the driving force behind OCD. But with that, we usually recommend mindfulness techniques. So rather than focusing on the thoughts or the ability to stop them, you acknowledge them in the sense that it brings you to challenge yourself. So that can be done through practicing positive daily affirmations and maybe self-challenging that dialogue out loud. And it can be done through Azkar as well. So obviously just reminding yourself that your thoughts are just your thoughts and they hold no power over you unless you give them power. And that there is no power or might except with Allah. I think something I like to emphasize personally to everyone, with in any sort of mental health condition, is that it's extremely important to talk to someone. And it's just to remind them that even in Islam, it's perfectly okay to ask for help. The Prophet Muhammad sallallahu alaihi wasallam, he had his beloved companions and he had his wives for support. So who are we to not use the people that Allah subhanahu wa ta'ala sends to us for help and support? You know, there's many people that there's many people that you have in your lives that you can turn to, and actually I do understand that it takes a lot of courage, it takes a lot of strength to take that first step, but those people are in your life to provide you relief from Allah subhanahu wa ta'ala as well. So it's important to see it through that perspective as well. And I think finally there's a lot of sort of a lifestyle advice that I'd give to anyone with anxiety, which would be, obviously, if you suffer and live with anxiety, it's probably not wise to have like 3 cups of coffee or tea a day. So eliminating caffeine and in turn optimizing your sleep. As Sheikh Saeed said, being active, that does release endorphins, which are happy hormones. Creative hobbies, baking, crafts. I think I saw something recently where there's a workbook where you can trace the Quran. So I thought that was a really nice new sort of mindfulness hobby. And again, just changing your diet to something more healthy, practicing deep breathing. I know that some smartwatches actually have this incorporated in them, so that if you are going through something, you can just there and then practice a 2-minute sort of deep breathing exercise. So that's just a brief sort of overview as to what you can do in addition to the mainstream counselling.
Thank you so much, Isma. That was really really valuable, and especially with the grounding. I always get mixed up and then I'm trying to think of 5 things I can smell and it never works. So that was really good, and I really liked the scheduling in the worries. I think I'm going to add that to my calendar. So thank you so much. And lastly, we're going to go to Imrana for what are the medical treatments that normally happen for anxiety? I think there is sometimes a worry that if you go to the doctors with anxiety, you're just going to get sent away with medication and that's it.
No, again, thank you for the question, and I'm loving this the discussion. It's so rich what we've had so far, and I guess just to touch on some of that, and I will show you the link to your direct question. So I mean, just looking at the, you know, how Sheikh Saeed described how spirituality and faith has such an important role in healing, and also the things that Isma described in terms of the well-being, what kind of we term as well-being strategies, are really important for for effective treatment. And just taking a step back, so I guess traditionally a lot of mainstream NHS services kind of had a standard treatment or a standard way of approaching treatment, and more recently within the NHS they realized that if a treatment is unrelatable to the patient, so the patient can't relate to it, then firstly they won't access it, and secondly, if the treatment is not rooted in their reality, it will be less effective. So I'm describing that because there are changes within the NHS at the moment. There's something called the Community Mental Health Transformation, and there's various other things which are having a more of an emphasis on this kind of looking at wider determinants of health and looking at and giving kind of holistic treatment options. So having said, I mean, the reason I'm saying that is in some areas, for example, they even trialing Islamic counselling for those people who feel that's what they need or would like, that would help them, you know, with their framing their anxiety and other mental health conditions, and looking at that as a treatment option. So I think in terms of kind of medical treatments, even that is evolving to be a more holistic approach. But kind of to your direct question, so if you went to a GP or a medical professional with anxiety, then essentially we use something which is devised by NICE, which is a stepped care model. So it's kind of, I know time is of an essence, so I'll very briefly, the kind of 4 steps going from the least intrusive to the most intrusive. And at the first level, it's about kind of identification, assessment, and self-help. So you may see a GP, they may listen to you, talk to you, ask you questions, and you may go away with what you feel is nothing. But actually, as Isma and Sheikh Saeed have said, there's simple things that you can do which are even more effective than medicine. So having a therapeutic relationship with your GP, that therapeutic relationship actually is now there's evidence to show, in particular for depression, where there's a lot of overlap with anxiety, that it's more effective than using an antidepressant medication. So not to underestimate that compassion that you give, that you receive and you give to each other, and also in professional settings. So that's kind of step 1. Step 2 is more looking at a psychological approach. So some of the things that Sister Myira described. And also there's a lot of they may signpost you to lots of online resources which can support with that psychological support, and there may be some digitally enabled therapies they may offer. And then step 3 is a bit more when there's a little bit more complexity. There's use what we call high intensity psychotherapy, and that's where you would consider medication. So just so we're clear that that's kind of like at step 3. So medication shouldn't be the step 1 answer when you go and see a practitioner or clinician for anxiety. Yes, medication can have a role, but it almost never has a role on its own. It's complementary to these other more kind of staple treatments for anxiety. And I guess what I should mention, if we're talking about standard therapies in NHS, is what used to be called IAPT, which is now rebranded to NHS Talking Therapies. So that is a kind of very structured modality of therapy, but that's what you offer kind of, in terms of really between step 1 and step 3, and that's a self-referral. So actually you don't even need to see your GP to access that, and that's available for anyone, and it's also it's free, and it's as I said, it's a self-referral. And then you have step 4, where you mainly do use medication, but you use a lot kind of a more complex MDT approach, and you may be kind of referred to something called secondary care psychology. So it's modalities are slightly different. The approach is different, more intense, and usually for longer. So I mean, I could go on about different types of medications, and I'm happy to take that in the question and answer, but just to emphasize that it is really a holistic approach, and medication only plays a small role. Just one more thing I would say. So historically, you may feel that actually when you go to see a GP about anxiety, you end up with a prescription. I think because historically, in terms of access to free NHS psychological services has been quite limited, and that's been a limiting factor. So the GPs, they're sitting, okay, I can refer them to psychotherapy, but it'll take them 6 months to be seen, or I can start them on a pill now, and the patient is desperate. But I think there's more and more emerging evidence that actually those basic things like those well-being strategies, regular exercise, therapeutic relationships, they are more powerful and of more benefit than medication. And luckily within kind of NHS, there's more the access through to psychological therapies theoretically should be a lot quicker than it was historically, with lots of investment going into that.
Thank you so much, Imrana. So we're going to move now to the Q&A section. There's been lots of discussion in the chat, and I've had a few questions messaged to me. But the first one is, at the moment, we're in the middle of, or we're just at the beginning of exam season, especially for a lot of young people. So how would you deal or talk to a young person about anxiety and stress surrounding exams? Who wants to take that one? while you're all thinking, let me just let everyone know that this webinar is recorded or is being recorded and will be put on YouTube in the coming weeks, inshallah.
I don't mind kind of, I bet three people are about to jump in. So no, I kind of, the first thing I kind of want to say to that is there's something around normalizing the feelings. You know, there's something around to feel anxious. And I'm thinking back to what Sister Imrana you were saying about the point at which anxiety actually becomes something that is disabling us, is actually having a regular severe impact in our daily life, versus a feeling of anxiety, and that there being a difference between the two. And so I think there's something around actually being anxious about something, if it's proportionate to the experience you're in or about to go through, also needs to be normalized as well. So I think for me, there's something around naming that to be anxious about upcoming exams, to be anxious about anything which is a huge unknown, to be anxious actually is a very ordinary response to it. Now, that doesn't mean that everyone is going to and automatically going to feel anxious, but it really is to make it really clear that to feel anxious with an upcoming anticipated event, such as exams or anything that's about to come up in your life, it's a absolutely human, normal reaction to feel anxious in response to it. So I think there's something about that, and I'm sure my colleagues on the panel will equally add to the answer as well.
Yeah, Sheikh Saeed, you've got your hand up.
I think just to add to what Sister Myira said, I think that firstly, especially with young people, I think is understanding ourselves and understanding emotions, and maybe being able to name the emotion and working with that, you know, what does it feel? So the identification, the naming, is really important. But also from an Islamic perspective, when we have exams, we try and say to the young person that, you know, Allah subhanahu wa ta'ala, success comes from Allah subhanahu wa ta'ala. You do what is in your capacity. Allah will not burden you more than your capacity. And also by, you know, that our tradition is to, you know, we plan, we prepare for things, we do what is in our capacity. And at the same time, we trust in Allah subhanahu wa ta'ala. We know that, you know, everything that happens doesn't happen without Allah's knowledge and Allah's guidance. So, you know, also making, you know, dua, you know, when Musa alayhi salam went to Fir'aun and he asked Allah, you know, help me, give me someone from my family to help me. So he gave him Harun. So also asking for help and asking, you know, for support is really important. And then Musa, he said, you know, when he asked, Rabbi shrah li sadri, Ya Allah, expand my chest, wa yassir li amri, and ease all my affairs, wahlul 'uqdatan min lisani, and remove the tightness from my tongue so people will understand my speech. And then he said, waj'al li waziran min ahli, and make someone supporter for me from my own family. So it's really important also that we support young people, we give them the opportunities, we encourage them, but at the same time, we don't make exams, you know, this kind of big thing for them that they are overwhelmed by the anxiety. You know, we say that, you know, these are, inshallah, things that will help you in your life, but you only can do what is in your capacity.
Thank you. We've got lots of questions. I'm just scrolling up. Someone's asked what to do if their GP isn't taking their symptoms seriously. We could expand that and say what to do if you feel like whichever practitioner you're engaging with isn't taking your symptoms seriously. Yes, Imrana. I was going to unmute you anyway.
Yeah, I mean, it was directly asked about GPs, and I guess I can relate to with that patient experience. So just to say a couple of things. One is the reality is that you'll have a short amount of time with your GP, and so it may you may perceive it to be that you're not being listened to, but it's just that's the restriction of the system, that you've got a certain amount of time that you've got to get through, I guess, a lot of content and discussion, particularly if we're going for a shared care approach. The other thing again is sometimes you might not go with a fix, with a tablet or something that's going to fix you straight away, but that's part of mental health and that's part of healing. There is no quick fix, and as I've said, it may feel like you've gone away with empty-handed, but having, as I said, building that link, that relationship with your GP, with your practitioner, it is therapeutic itself. And also I think again, as I was describing the step care model, that the step 1 and step 2, a lot of that is kind of empowering patients to do it themselves. So kind of using online resources for psychoeducation and well-being strategies. So the mainstay of the treatment actually is not reliant on your clinician to be, I guess, taking it seriously, because the onus and the emphasis is that you can do a lot of this with these resources, as I said, refer yourself to talking therapies. And again, a lot of these things, as I said, are empowering patients to do that, to do so.
Amazing. Thank you so much. Another question that we've had is how to encourage someone to seek support, perhaps when they seem unwilling or even nervous about seeking support. Who wants to come in on that one? I'm gonna just start unmuting people. Myra, there we go.
So the question being around how can we support somebody or encourage somebody to go and get help and support?
Yeah.
I think I kind of want to flip it on its head slightly, because I think there's something around, and I think this is actually something I say to myself very often as well, which is, if I was the only one experiencing this, why am I able to Google it? Why am I able to find a million bits of resources and content online about it? And so there's something for me around, if I was the only one, say in this instance, kind of we're talking about anxiety, if I was the only one that was feeling anxiety, and so therefore I'm reluctant to go and get help, or feel I won't be believed, or feel like for whatever reason I don't want to get help, why then are there all of these resources and information about it? I can't, all of that can't have been created just for me. So I think, again, there's something about finding perspective in, well, I'm not the only one. I'm not going to be the only one feeling and experiencing this. And therefore, I'm not going to be the only one that in experiencing or feeling it, I then don't need to experience that on my own. I need to recognize that there are lots of support and resources out there. And so I think there's something about, and again, very common with people that are experiencing any kind of emotional or mental health distress or upset, or experiencing anything, is we often feel like, A, we're the only one going through it, and B, like we're all on my own with it. And I think there's something around the very nature that we do these kind of webinars, the nature that we put out between all our organisations. We put out so many so much resources and content and services to support people. I think it's just so important that what we say to that person is, you're not the only one. You're not the only person that will have been experiencing this and feeling this. And, just Google, have a look, see what resources and help are out there. And I think also part of that barrier to accessing any kind of support can often be around the fears of being misunderstood, the fears of being stigmatized, the fears of not being believed. There are so many of these barriers. So again, I think it's something around encouraging somebody to do their research, encouraging somebody to find either a helpline, a counsellor, a service, a support group, or an online resource, to start getting them used to being able to reach out for that help. We're not going to be able to take somebody from being really quite resistant to help straight into, right, let's get you set up in long-term therapy. They're just not going to engage in it. But I think it's about trying to find those small stepping stones to getting them there. And I think, as I said, kind of the reverse psychology on this might just be, okay, you don't want to get help right now, but let's sit down and let's Google. Let's do a bit of research together and see and identify how much support is out there. Because if there is that much support out there, do you think you're the only one experiencing it? So again, it's about encouraging those small steps into helping somebody, into supporting somebody getting that help.
Great, thank you. And before Imrana wants to add, while Imrana is unmuting, I'm just putting in the chat a feedback form. This is our first webinar that we've done in quite a few months, so we'd like just a bit of feedback on it, any topics you'd like us to cover in the future. So I'm just putting it in the chat, and it'd be really helpful if you could fill that out. Imrana.
Thanks, Jamilla. I think that feedback form is perhaps more important than what I was going to say. So yeah, please do fill that in. So my answer to that question was really, I guess slightly tongue in cheek. You know, the proper answer is what Myra described. But as a GP, I have a lot of patients who come and the way they open the conversation is that, oh, you know, and particularly I have to say for the men is, oh, my wife nagged me, had nagged me so much. I've come, or my friends have been nagging me, or my colleagues have. So I think just kind of I guess, I mean, not to use the word nag, but clearly in those cases the nagging has been effective. So just again encouraging, reminding, and if you think somebody does need help, then do approach them in a sensitive way, and eventually you know, the penny will drop and people do seek help.
Thank you so much. I'm afraid that's all we've got time for in today's webinar. Thank you so much to all of our speakers and for everyone who is attending. I'm sorry that we couldn't get to everyone's questions, but inshallah we will in future webinars. Please do fill out that feedback form. I'm going to post it again just while everyone is leaving. It would really mean a lot, and that means we can continue doing amazing webinars for everyone. So thank you so much. Assalamu alaikum and have a lovely evening.